From CITI program, I'm Darren Gaddis, and this is On Campus. Today, what institutions across the country are doing to support faculty mental health needs, how to create a community of care, and why faculty mental health is important. I spoke with Negar Shekarabi, coordinator of faculty and staff support services at the University of California, Irvine. As a reminder, this podcast is for educational purposes only. It is not intended to provide legal advice or guidance. You should consult with your organization's attorneys if you have questions or concerns about relevant laws and regulations discussed in this podcast. Additionally, the views expressed in this podcast are solely those of the presenter. Hi, Negar. How are you doing today?
I'm good, thank you. How are you?
I'm doing well, and thank you so much for joining me today to discuss faculty mental health. A very timely topic and often, lots of times, left out of the discussion on campus mental health.
Absolutely. I think it's such an important topic and also a timely conversation.
Absolutely. Mental health and the concept of self-care has always been important. However, it seems like we have been hearing more and more about student mental health recently, especially since the onset of the COVID-19 pandemic. How does this directly impact the mental health of faculty and staff members?
Yeah. Even prior to the pandemic, it was really clear that students were experiencing increased rates of anxiety and depression and suicidality. And it was expected that the pandemic would, of course, exacerbate that for our students. So our faculty are actually in a really unique position because students do turn to them for their mental health needs, and there's some indication that they're turning to them at an increased rate. So often our faculty are the first to know when a student's struggling because they may observe a change in performance or behavior, or because the student may reach out and disclose their struggles to them directly. And we know that this is impactful to our faculty because they tell us that it is, but now the research is really starting to support the significance of that impact. Boston University's School of Public Health recently did a study and found that about 20% of the professors that they surveyed said that supporting their students through mental or emotional distress has had an impact on their own mental health. And that's really significant because it tells us that this role that faculty play often as gatekeepers for student mental health is impacting them on a personal level. And we don't really know yet if our institutions are adequately structured to support that impact. And the circumstances that are impacting our students, in recent years are not unique to students, of course. We're all living through a global pandemic that forced us to face so much uncertainty and change in a short period of time. We've all experienced loss in many forms, loss of loved ones, loss of time, loss of experiences. And we've all watched the country faced with a renewed racial reckoning during the same time period, not to mention all the other global events that we see and hear about and are touched by every day. So our faculty are in this unique position where their students appear to be increasingly turning to them for support, while many of them are also navigating the personal and professional impacts of the last 2 years in their own lives. So our faculty are experiencing increased rates of burnout, and they're grieving, they're struggling to cope with uncertainty and change in their work environment that's been far too frequent over the last 2 years. And many of them are also navigating how to support their own children at home through a pandemic. So these are all really significant impacts our faculty are navigating. And really, lastly, I just wanted to also highlight in terms of impact, we also have to keep in mind that across the country, many of our institutions of higher ed also have affiliated hospitals that combine services of a hospital with the education of medical students and medical research. So we can't understate the impact that the pandemic has also had on the mental health of our healthcare faculty as well.
In your current role at UCI, you're at the forefront of faculty mental health and support. From your experience, how have you seen institutions across the country support their faculty and staff mental health needs?
Yeah, the data suggests that faculty are really eager for more training that helps them recognize the signs of emotional distress so they can be more effective in how they assist their students and hopefully themselves or their colleagues getting connected with the help that they need. So some campuses are really answering this call and increasing mental health training opportunities that are tailored toward faculty. So both trainings that are focused on student mental health, but also trainings that help faculty to recognize and respond to mental health concerns among fellow faculty or staff that they may supervise, and even to recognize when they might need to reach out for help themselves. So as one example, our campus, in the early months of the pandemic, we spent some time identifying and creating pre-recorded webinars of our most requested mental health trainings, and having those trainings readily available online with limited barriers to access really allowed us to meet the faculty where they were in terms of their need for quick, accessible information on really tangible steps they can take to support their students, colleagues, and themselves. So the topics we really identified on our campus were things such as managing disruptive and distressed students, an overview of their faculty behavioral health benefits. We did a seminar on teaching potentially traumatic topics and integrating well-being concepts into learning environments. And at the same time that we were getting some of these in-house trainings up on the internet and easily accessible while we were all working from home, we launched mental health first aid on our campus last spring. And I know many campuses across the country are starting to look at programs such as mental health first aid. So over the last year or so, we've been able to offer the course and certify hundreds of UCI faculty and staff as mental health first aiders. And we found it to be really effective way of doing was to train our own faculty and staff to be instructors. And so we can, in a more sustainable fashion, continue to offer mental health first aid on our campus. I think in addition to training, some campuses have historically distributed resource guides on how to respond to distressed students. So these are those guides that have all the really important phone numbers and decision trees around risk. And I've started to see some campuses develop parallel guide as these student support resources. They've developed some parallel guides for faculty support resources. So how do you support a colleague who's in distress? What are the numbers I need to keep in mind? What are the decision tree questions I need to be asking myself around risk? And this really helps to communicate that faculty are not only having resources that are available to them on their campus, but it normalizes the utilization of those resources in an effort to combat stigma. So I think you're seeing across many campuses a new investment in providing educational opportunities to enhance a sense of confidence and competence among faculty to have these difficult conversations about mental health. But I will note some campuses are probably during this time also recognizing that they may have a gap in how they're supporting faculty mental health. So over the last year, I've had a handful of campuses from across the country reach out to my office for consultation about how they can better support faculty mental health. And their faculty senate or other offices who are stakeholders in faculty development have recognized that the faculty are struggling and that their campus doesn't necessarily have the resources or services or educational materials to direct them to. So they're taking this opportunity to really start this conversation on their campuses and find ways they can enhance their already existing structures and mechanisms, or find out how and to whom they can advocate for more resources. So whether or not what's available on a particular campus is sufficient to meet the needs of your faculty is, of course, a very subjective question. Most institutions are going to have some combination of behavioral health benefits within their medical plans and an employee assistance program that offers mental health support and counseling. So for many campuses, depending on their size and the culture amongst the faculty, that may be sufficient. And the work is really just about making sure the resources are effectively marketed to faculty and easy to navigate. Whereas for other campuses, this may be not enough, and they may look to create additional resources for their faculty. So on our campus, that's the type of analysis we underwent that led our campus to create the Office of Faculty and Staff Support Services, which I lead. So there was feedback coming to us from our campus faculty in 2016 that they could really benefit for someone embedded within the UCI community who could serve as a support person to help them navigate their resources and benefits and assist them in crisis situations, and also be a point of consultation about issues in departments that intersect with mental health. And on our campus, because we have an external EAP, our campus really found that creating an office on campus that was tasked with these roles could help reduce the barriers to access and fill in any gaps that the existing resources couldn't fully fill. So we've really found that a particularly helpful approach on our campus. But of course, that was in response to really specific things about our campus. So it's going to look a little bit different on every campus.
It sounds like institutions across the country are strategizing and using tools to better support faculty mental health needs. Thinking about the support that is already out there for faculty and staff, what can administrators do to better support the mental health of faculty and staff?
Yeah, well, as I mentioned, most institutions, of course, offer some type of emotional support resources for employees. The challenge really now is about meeting the increased need. So, most of these types of resources, whether it's a medical plan or an employee assistance program, or in our case, an on campus resource, they've really offered low or no cost confidential support for years. What's really changed is that level of distress has increased and the demand for services is now increasing right along with it. The awareness among campus leadership, I think, about the importance of mental health related needs for our faculty has also increased. It's not an unknown problem. And so that increased in awareness has been there for many years as well, though I believe COVID has really made it more salient. So I think that awareness can go a long way. When faculty know that the institution and the institution's leadership is aware of the importance of mental health and acknowledges it, then it creates more transparency and openness more generally. So I think that's a really good starting place for institutions who are looking at this issue. Can we make mental health a top priority? Can our leaders articulate how important the mental health of our students, faculty, and staff is? There's a myriad of ways this can be done. As an example, in 2020, the University of Michigan formed a task force at the request of its provost and vice president of student life, and they looked at well-being needs and resources on campus and made a set of recommendations and outlined actionable steps that their campus could take as an example. So I think speaking to your key stakeholders in that kind of process is really important. Who needs to be at the table, who has a really important role both in the short term and the long term well-being of the campus. So this is this idea of not, working in silos. Another step that can be really beneficial, especially at campuses that already have a myriad of resources, is simply to simplify the access points. Find ways to simplify what is already available, who has access to it, and where should people start. We know that lack of visibility or clarity about the resources is a really strong contributor to low service utilization. So how can your campus streamline things, centralize things, and simplify access? I think our faculty are also on another level telling us what they need. In that same Boston University study that looked at the role of faculty in student mental health, they also found that half of their faculty that they surveyed agreed that their institution should invest more in supporting faculty mental health and well-being. So their message is very clear: more training and more investment.
So it seems that many faculty members have already vocalized the tools they need to better support their mental health needs. Positioning or transforming the conversation to focus on academic departments. What can academic department chairs and leaders do to create a community of care to better support one another's mental health needs?
I think how academic departments respond and manage mental health is really this hidden but really important aspect of mental health care and self care. Actually, so that's really about the community care piece, which is the part of the self care narrative that we usually skip over. And really, community care is really about using our power and our privilege and our resources to help people who are within our reach. And in a department that is made up largely of your faculty and staff. So a department can start to look at its practices and see where is there an opportunity for practices or even small actionable steps that will effectively center the group and center support and healing. This could look like creating space really for mental health and well-being to become a part of the dialogue within a department. When leadership acknowledges and articulates it, again, this goes a really long way to create psychological space for others in the department to be able to talk about it. Is there a way that our department can incorporate this regularly into faculty meetings or gatherings? Can leadership model self-care and setting boundaries and encourage others to do that? Can training topics be hosted within our department that prioritize mental health awareness and learning about resources? I think there's a really clear intersection when we think about this between community care and trauma-informed principles. So we've come to understand that taking a trauma-informed approach can create an environment where more people feel safe and included, which goes a really long way in mitigating mental health struggles. So ultimately, this is also the goal of community care. So trauma-informed principles tell us, for example, that trustworthiness and transparency are really important. So departments can ask themselves, are the expectations made very clear in our department? Are our practices consistent? Are our boundaries in terms of faculty time and faculty priorities, are they appropriate? We also know that with trauma-informed principles, collaboration and mutuality are important. So in our department, do we act as allies, not adversaries? Are there opportunities for shared power in making some of the decisions of the department? And then lastly, I'd say important to trauma-informed principles is this idea of empowerment and choice. So do all members of our department feel like they can be heard, that they have opportunities to build their skills? So these are all really traditionally trauma-informed ideas that departments can adopt to enhance the mental health of everyone in the department.
And what role could students potentially play to assist in supporting the mental health needs of faculty and staff?
That's a really interesting question, because we don't typically think of our students, right, in the role of assisting faculty, but we know because of the proximity of our students and faculty to one another, students may at times be the ones who notice a faculty member may be struggling. So I think in some ways it comes back to this idea of simplifying and streamlining access. If our students know that there are resources for my faculty, just like there are resources for me, and it's easy to find that resource, they'll be more likely, I think, to approach or reach out to anyone, even their faculty member, if they're concerned about them. Not knowing the resource is a very strong barrier to approaching someone you're concerned about. And I think it comes back to training as well. We've talked a lot today about mental health training, faculty mental health training, student mental health training, but at the core of it, the principles of how to recognize and respond to distress in our community, it's the same. The core principles are the same. To the degree that a campus can infuse this type of training into the campus culture, I think everyone benefits.
What else do we need to know?
I think that the timing that we're in now, in terms of many campuses really looking at how are we navigating this post-COVID, return to normal, it's a really great opportunity for mental health to be part of that dialogue and conversation from the ground up as we rebuild and restart this process back to normal. There are a lot of things that many of our campuses discovered were missing or insufficient or needed additional support during these last 2 years. And the timing is really great now to restructure and recalibrate around that. So I think that's an important message to take home. If you're on your campus and you're thinking about how you can influence the way that faculty mental health is supported, I think that the time is now. My sense is that on many campuses, ears are open and leadership is really eager to see what are some actionable things we can do on our campus that we can maybe implement in the short term and the long term to really create a different picture for our campus should we find ourselves having to respond to something like we did to the pandemic again.
Thank you for joining me today. Be sure to follow, like, and subscribe to On Campus from CITI program to stay in the know. I also invite you to review our content offerings regularly, as we are continually adding new courses and webinars that may be of interest to you. All of our content is available to you anytime through organizational and individual subscriptions. You may also be interested in CITI programs understanding and addressing mental health on campus, opportunities and challenges in higher education webinar. Please visit the CITI program's website to learn more about all of our offerings.